Good morning. I'm Xifeng from Zhejiang University School of Public Health. My topic will be on development of a novel multidimensional measure of aging to predict mortality and morbidity in the prospective MG cohort. So my talk will be presented in two parts. The first part is on measurements of aging. The second part is on healthy lifestyle and aging. Yeah, this one, I cannot see the slides. Can you?
Yes, we see the slides. We see your slides.
Okay, just a second. Can you move this one? Okay, thank you. Okay, so the world's older population continues to grow unprecedentedly. In 2015, about 8.5% of the population are age 65 plus. It's about 617 million. But in 2050, there will be 2.1 billion of people will be aged 65 plus. So aging is the greatest risk for a majority of chronic disease. And with the increase of aging, the prevalence rate of chronic disease also increased. Therefore, to promote healthy aging is urgent. And we need to identify individuals at high risk of age-related disease at an early stage and then provide effective interventions. So age-related disease accounted for about 51% of global disease burden among adults. And this is the estimation in 2017. And China has the largest population of elderly people in the world and is also one of the countries experiencing the fastest aging rate. And therefore, accurately assessing the process of aging is of great significance, and also it is aligned with the China's national strategy needs. So previously it has been found that the people at the same age, they might have a different pace of the different pace in the aging process, and therefore chronological age alone cannot reflect an individual's actual aging level. And also, however, the how to measure aging and it remains unclear. And generally speaking, there are three types of aging measurement. And one is biology aging, another is phenotypic aging, and also another is functional aging. And the hallmarks for each metric of aging is listed on the right of the slide. So from the matrix, you can see aging is really a multidimensional process, and therefore measurement of aging is a complex process. And the biology age can more accurately assess the degree and the speed of aging compared to chronic age. And the biology age usually is measured by molecular biomarkers based or the biochemical indicators based. So the molecular biomarker based biology aging is usually expensive and not suitable for large population. And however, for the biochemical indicators, like the indicators, biomarkers, and from the health screening, and currently the research is primarily focused on Western population, and there is a lack of biological age specifically tailored for Asian population. Therefore, we need biology age for Asian populations. So aging is a dynamic process, and so such has a strong heterogeneity. So such leading to a significant variation in the rate of aging, like the speed and the pace is different within and between individuals. So you can see from the left figure. And also throughout the course of the life, the rate of aging can dynamically change due to factors such as the individual's choices. For example, the environment factor and their healthy lifestyle, factor. It will result in personalized aging trajectory. And however, currently, there is a lack of availability of research on aging trajectories based on objective indicators. And also, there is a lack of research on aging trajectories specifically focused on patient population. And also, there is a very few studies look at the aging trajectory and the healthy lifestyles. So it has been shown that healthy lifestyles are key determinants of health and are also closely related to aging-related diseases. Therefore, advocating for healthy lifestyle is an important approach to achieve healthy aging. And the previous studies have found that a plant-based diet may lower the risk of aging-related disease and promote healthy aging. However, most studies have focused on specific plant-based foods or nutrients, and they did not really look at the overall effects of the dietary patterns. And therefore, the relationship between dietary quality and the pace of aging still remain inclusive. So based on this background, we have designed a study. And so basically our studies have three objectives, and it's all around the goal of early identification of individuals at high risk of aging and implementing effective interventions. The first objective is to construct novel multidimensional aging assessment indicators based on a large prospective cohort of East Asian populations. And the second is to identify dynamic patterns of aging indicators and explore the association between different aging patterns and all-cause mortality. And the third part is to investigate the association between healthy lifestyles and aging. So next, I will present some of the results on the first part is on the measurement of aging. So our study population is from a prospective MG cohort, and this cohort is based on Taiwan. And so basically, this cohort is based on the health screening population with about 600,000 subjects. And so the follow-up time is about 10 years. And all the participants have been asked to fill out a questionnaire and also followed by medical screening and physical examinations. And currently, this prospective cohort has a large biorepository and also have the repeated measurement data. About half of the participants underwent 2 or more medical examinations and a questionnaire survey. And also, this prospective cohort has been linked to Taiwan, the cancer literature, and the DESFI, so we can get the cancer incidence and the mortality data. So we have constructed the biological age. So basically we have about 44 candidate biomarkers, and then we use the random forest method to select the biomarker And then we use the Levin method to construct the model, and then to construct the model for the MDH. It's a multidimensional aging measure. So these are the baselines of the study subjects. And so totally we have included about 397,068 participants. And about 47% of them are males. And also about 70% of the subjects without any of the chronic disease. And there are 16,074 subjects died at the end of the follow-up. And then we use the Gini mean decrease measure, and also the measurement area rate, and from the forest, random forest tree, and also the correlation metrics to select the biomarker. And totally we have found 14 biomarkers for the multidimensional age measurement. And also we found that the MD age and the chronological age has a strong correlation. And also we calculate the MD age acceleration, and it was calculated as the residuals resulting from a linear model regressing MD age and chronicle age. And then we found that here, the bottom figures, the distribution of MD age acceleration and also the MD age acceleration was fairly normally distributed. And then we look at the created model for MD age for all-cause mortality, and we divide the subjects as the training set and the validation set. And our results show that the multidimensional age has a better prediction than the chronological age. And actually the full model and the final prediction and the power is about 90%. And then we also look at the association of the multidimensional age with all-cause mortality. And we found as the MDH increased per 5 years, and they increased the mortality by 64%. And also this association was all across the different gender and also the different age group. And here, I just want to remind everyone that the MDH acceleration was calculated as the residuals resulting from a linear model regressing MDH on chronological age. And therefore, MDH acceleration represents multi-dimensional age after accounting for chronological age. And then we group the subjects as 4 groups. Like if the MDH acceleration, and if it is equal to 0 or 1, equal to 0 or less than 0, and then we put it as a reference group, is as a group of 1. And then if the acceleration is great, divide them as totals. And then what we found, the case here is the Kaplan-Meier survival curves. And then we compare the survival probability in different aging acceleration groups. And what we found, the group with the highest aging acceleration value has the highest mortality. You see in the total population or in the age 40 to 65, and especially in the group of age 65 to 85. And actually after follow-up for 14 years, and we found that here the mortality is about in the greatest, in the highest acceleration group is about 50% deaths. And then another one is only the one with the least acceleration is only 25% deaths. And then we also calculate the lifespans, and in the the 8 different aging acceleration groups. And what we found in the greatest aging acceleration group, and they lost lifespan by about 17 years. And then the medium acceleration group lost the life about 6.5 years. And then the first total acceleration group, and it's about lost 3.4 years. And then we also look at the association of the multidimensional age acceleration with the chronic disease risk. And then we found like the MDH every 5 year increased the chronic disease risk by about 75%. Again, these results are across the different group, all the results are similar. And since aging is a dynamic and heterogeneous process, it may better be captured by repeated measures of aging biomarker along the years. So for what we did is we choose the 4 time points to calculate the MDH acceleration. And then we use the group-based trajectory modeling and to look at the person's aging trajectories. So basically we have put the participants and grouped as 3 groups. One is high degree acceleration age and a medium degree acceleration aging and a slow aging group. And here you can see the risk of mortality in different groups categorized by aging trajectory group. And so for the individuals with the high degree of the aging trajectory and is associated with high risk of mortality. So next, we look at the association between healthy lifestyle and aging. And so we calculate the MDH acceleration at the 2 time points. And then we look at the health lifestyle factors and what are their impact on the differences in MDH acceleration. And then we also look at the differences in MDH acceleration and how they are associated with all causes of death, like the mortality. So what we did is we first calculated the health lifestyle scores. And the health lifestyle scores is based on the number of healthy lifestyle factors. And then we did so what we did was to look at the healthy lifestyle and how they affect the MDH acceleration. And so we found if the number of the score of the healthy lifestyle increased, and then they become the age acceleration, the risk for age acceleration is decreased. And then we also looked at because the plant-based dietary patterns, we also look at how they can affect the age trajectory. And so we calculated the healthy plant foods, the scores, the index, and also we calculated the unhealthy plant foods and also the animal foods. And then we assigned the scores for each food group according to the impact frequency. And totally we have 14 groups. And then we calculate the plant-based diet index and the healthful plant-based diet index. And then we also calculate the unhealthful plant-based diet index. And then what we found that the plant-based dietary pattern and basically is associated with the the plant-based dietary pattern, and they can reduce the risk for individuals become the medium age trajectory group, and also the high degree accelerated aging trajectory group. So basically, the plant-based dietary patterns and the healthy plant-based dietary pattern can reduce the risk of become the high degree aging trajectory. And however, the unhealthy plant-based dietary patterns can increase the risk, become the highest degree acceleration trajectory group. Okay, I conclude my presentation here, and thank you for listening.